Healthcare in America is expensive. We have the best medical education, we have more medical resources, we spend more money per person on healthcare in America than any other nation in the world by almost 2 to 1. And yet we have consistently the worst health outcomes of every other developed nation in the world. Part of the reason of that is that we have so many people who cannot access health care, either because they're poor and they are uninsured, or because they live in a medical desert where there's great needs but not enough doctors. CCHF stands for Christian Community Health Fellowship. We're a nationwide community of Christian health professionals who are committed to living out the gospel through healthcare among people who are experiencing poverty. CCHF was started over 40 years ago by a group of young health professionals straight out of training who asked the question, what would Jesus do if he had been born 2,000 years later and was a family medicine doctor or a nurse practitioner instead of a carpenter? The issue is not that he would treat diseases differently, but that he would treat people differently. And it's our job to take those principles and those attributes and apply them to the organizations that we run and to the way that we engage our patients and our communities. When a patient comes into one of our Christian clinics, we want them to know that they're loved, that they're valued, and that they're respected. We're committed to give them the same level of excellent care that we would be proud for our mothers or our daughters to have to depend on. Most of our providers pray with their patients and talk to them frankly about just their spiritual health. There are over 300 clinics that are doing this across the United States. A lot of our clinics only care maybe for a few hundred people a year. We have others that care for literally scores of thousands, but because everyone is doing what they can, more than 1 million people a year are being served in CCHF clinics across the country. That's more than 1 million people who are receiving excellent, compassionate health care, who are being prayed for by their providers, who are experiencing and hearing about the hope and the love that we have in Jesus Christ. It's people like you who make that possible, and we're grateful for the opportunity to share this ministry with you.